Okay, guys, I'm Jeff Brown, one of the pediatric hospitalists. This is the topic today. Let's make this very informal. Questions, comments, whatever. Lindsay, you're going to recognize this slide from last night. The social media issues. Whoa, what happened? Did I do something wrong? Nope, there it is. Must have missed a slide in there. Took this earlier today in the nursery. Kind of gives you an idea of the role social media is starting to play with kids. OMG, I just got born. The other thing I wanted some input on today is, you know what, Andy, you're going to find this surprising, but one of the moms the other day, I walked in the room, you know what she said? Dr. Brown, you look like a movie star. And I said, no, but I started to think about it. I don't know, what do you guys think? Huh? Any comparison? Okay, so somebody once told me a long time ago to give a talk, you got to tell them what you're going to tell them, and then tell them what you told them. So basically the three take-home messages today: kids are not small adults. We're going to talk about pediatric and teen ski injuries and emergencies. And like my kids call me, I'm a helmet Nazi. So ski helmets, that's a big part of what we're going to talk about. So we want people to go left and not right, but we all know the drill. Even though they got their helmets on, they're having a good time. Ski patrol drags them off the mountain.
Is that the sign down there? Hospital that way, ski that way? Or no?
No, I pulled it off the net somewhere, I think. And so I don't know. Anybody know how many ski-related injuries we see in the ER every year? Do you have any idea, Liz?
Dana does.
Be interesting to know what that number is. Be interesting to know how many of them are kids and teens. It's a lot. It's a lot. Yeah, I gotta think this is probably the biggest ski injury ER in the country, probably, right? It's the only ER right at the base of the mountain, biggest mountain in the world. So, all right. So kids are not small adults. You got growth and development issues. They have faster metabolism, higher energy needs, larger surface area, and thinner skin. So this is a big take-home message you got to worry about with kids. They burn up their glucose really fast. They get cold, and they get dehydrated more than adults. So wherever your role is, nobody's ski patrol here, are they? And you guys ski patrol? Everybody's what, ER in the hospital? So I'm giving this talk to the ski patrol in a couple of days. And so one of the big take-home messages for them is they really got to take this into consideration for kids that are down on the mountain. Are they energy deficient? Are they hypothermic? Are they going to get dehydrated? Because you have to think about that a lot more in kids than you do in teens. Smaller blood volume, if they've got a laceration or a cut or internal injury, they can bleed out a much smaller volume of blood and be hypovolemic or shocky. So that's something to consider in kids. You may look at it and say, oh, that doesn't look like much blood, but it doesn't take much blood at about 80 cc's per kilo. They have healthy hearts. So unlike adults who are down, first thing you think about usually heart attack. Unless it's a kid with some kind of complex congenital heart disease, generally it's not heart. It can be respiratory, proportionally small nose, small mouth, large tongue, large tonsils, narrow glottis, smaller proportional airway, faster baseline respiratory rate. So we don't think about hearts with kids, but we have a much lower threshold to think about respiratory problems. Bones, joints, and ligaments are more flexible. They absorb blunt trauma, fewer severe fractures, but we'll talk about, they are prone to things like green stick fractures. You got to be really careful with kids that if the fracture involves the growth plate and it's not fixed appropriately, the bone can stop growing, and that obviously is going to be a big problem. They have a large head for body size, which makes them prone to getting some neck injuries. And again, they can get hypothermia because of their inability to regulate body temperature. Just a few developmental issues. We don't see a lot of toddlers on skis, but preschool, these are kids who are saying, why? No. Their gross motor development might not be very advanced at that point. School-age kids, these are the kids that want to, I have a 13-year-old at home, let me go ski by myself, see you at 4. You know, big questions with this age kid are when you kind of let them be independent and do their own thing. Peer acceptance is big in this group. Adolescents, we all know, more independent, mature, sense of invincibility. This in itself makes them very high risk for ski injuries because most teenagers think they're invincible. A lot of them can have a real attitude, F you. They say, no, my kids have. And they're more prone to adult-like injuries, trauma, medical issues in this age. So what do we know? 60 million skier visits a year, 10 million skiers, 40% of 7 to 24-year-olds are skiers, and 3/4 are snowboarders. So this is a big delta change right here. There was a time where it would be completely flipped the other way around. So kids in this age group now are big boarders. You don't have to look much on the mountain to see that. Boarders are going to be prone to some different injuries than skiers are. As the males, as we all know, are really dumb, so they get 21 more times likely to get an injury than female. Andy, what do you think? Makes sense?
Yeah, I agree.
Guys do dumb stuff, right? Lindsay?
Yeah,
Don't you think?
show off.
Huh? The boarders and the skiers get about equal rates of head injuries, but boarders are prone to something called border belly, kaboom, ruptured spleen, liver injuries, internal organ injuries. Most injury in snowboarders results for falls or jumps. And of course, the big one we worry about are head injuries. Skiers are prone to lacerations, boot top contusions, thumb injuries, complex knee injuries. Boarders going down, they get the distal radial fracture, typically of the left hand, foot or ankle injuries. 10-year retrospective on splenic injuries in skiers and boarders. Border belly, snowboarders are 6 times more likely to get it than a skier. They both suffer from falls or jumps, although boarders more for falls and jumps and skiers more from collision. One of the evolving epidemiology in the field is that boarders in particular are very prone now to terrain park injuries. We're seeing some really nasty head, cervical spine, spinal cord, ortho injuries come out of terrain parks. And them tend to be much higher. Injury prevention needs to focus on equipment design, possible legislation. Colorado or California is the only state in the country now that has a mandatory helmet law for skiers, but that's kind of an evolving topic. If you look in Europe, Italy, Austria, Croatia, all have federal mandatory ski helmet laws for kids. So this is kind of an evolving area. If you ever followed bike helmet legislation, there's been a lot of progress made with that. Now there's a lot of counties and actually some states, New Jersey, that have mandatory bike helmet laws for kids. Ski helmets may not be far behind. Ratio of upper extremity injury to all types of injuries was higher in boarders and skiers by 3 times. Boarders fracture wrists, boarders dislocate elbows, skiers dislocate shoulders, snowboarders the left upper extremity, boom, was the most common one to injure. So this gives you an idea. Skiers, knee, head, face, shoulder, lower leg, wrist, thumb. Boarders, wrist, head, face, shoulder, knee, ankle, back. So what do we know about deaths? In 13 years in this country, 469, average about 35 nationally. It's interesting, we average about 20 a year in Colorado. Of those deaths in Colorado, about half are avalanche related. So it ends up being, of the total here, 469, 401 were skiers, 58 were boarders nationally. I couldn't find the number of what percentage of those were kids or teens. No decrease in mortality over the last several years, despite more helmet use. Again, Colorado is about 20 a year. Nationally, about 1/3 of ski-related deaths are avalanche deaths. I did think it was interesting. If you're on an avalanche, how do you die? 3/4 of the people suffocate. 1/4 is from trauma, and a very small percent from hypothermia. So this really speaks to a number of things. That new contraption that people wear, that airbag thing. Oh no, does anybody have one of those or ever used one? Or I think they work, from what I heard. If you, there was a big article in Outside this month about an avalanche, and a couple people survived with that thing. What do you call it? Avalon?
Avalon.
Yeah, they're pricey, aren't they? Like $1,500, I think. Heard that.
Yeah.
Oh, okay.
Avalon's like a snorkel. The airbag is called an airbag.
Yeah. So the idea with that is you create some space to breathe around your head till somebody finds you.
It keeps you on top of that avalanche too.
Right, like it.
So it's almost like a float.
Yeah, you
Yeah.
deploy it,
It's like
it's
a
like
bobber.
a parachute. It will keep you up at
Yeah.
the surface. Oh,
Yeah.
Yeah. So Some high-profile tragedies have really brought some notice. Natasha Richardson is the actress married to Liam Neeson. She took a ski lesson at Mont Tremblant in Quebec. Finished the lesson, was skiing back to the lodge, keeled over, no helmet, hit her head, died of head injury. Average cost, this is $500,000 per case, per kid. It's just acute. If you can't finish school, if you can't get a job, if you're institutionalized, I mean, the mortality, like many things, is just the tip of the iceberg. So for every death, there are many levels of injury underneath that. So head injury alone, traumatic brain injury, is a huge source of cost, concern, family trauma, etc. So same things that happen on the slope are ones that could happen anywhere. Kids can get respiratory problems with the list there, abdominal issues, altitude sickness, GI disease, exhaustion. This is a key one, I think, in kids, and I don't know, you guys that work in the ER, I think kids who get really dehydrated, hypothermic, exhausted, they'll present with a lot of weird somatic stuff. So if a kid comes in with kind of bizarre sounding somatic things, it may be ski related, and some contribution of it may be dehydration. It might be hypothermia, and to some extent exhaustion. So just something to be aware of down there. Seizures, if you have a kid with a seizure disorder, they can have a seizure on the slopes the same way they could anywhere. Diabetics might have a hypoglycemic seizure. You can see seizures related to traumatic brain injury. So yeah. Trauma that you see out there are typical things we all know about: head, neck, chest, abdomen, extremity. So the head and neck stuff on the ski slope, usually a fall. You can get superficial injuries, laceration, rip an ear, break a nose, or you can get a brain injury as well. And there's a whole range of stuff you can see, from fairly mild concussions to severe bleed. Concussions, the range of symptoms are all over the map, particularly with kids: confusion, loss of consciousness, memory loss, altered mental status, behavioral changes, seizures, irregular breathing, paralysis, skull fracture. So this is the big one. Kid hit something, hopefully helmeted, but particularly if not, you get a so-called counter-coup injury. The brain rushes forward, you get a bleed here, and then it rushes back, and you get a posterior bleed as well. And you get shearing of the veins that occur, so you can get a subarachnoid hemorrhage, you can get an epidural hemorrhage, you can get a intracerebral hemorrhage. All of them are nasty to see. I think brainstem injuries, you got to have a really bad fall to get a brainstem injury. Generally, these are the two big ones that we worry about. So again, this is just an example here with a skull fracture. You can get a fracture above the skull. You can get a subarachnoid hemorrhage. You can actually get damage to the brain itself. And, you know, these are some CT scans just to give you an idea. You don't have to be a radiologist to read this one or this one or this one. This is what it looks like if you have to have your brain open, the bone lifted out, repositioned. So obviously all that's good stuff to avoid. And then this is the big one now, the so-called second impact syndrome. This is the one that's got a lot of attention, like with the NFL and the sports. Bad weekend. Jay Cutler's out. Michael Vick's out. They're all out with concussions. Roethlisberger's the shoulder, I think. I don't think it's brain. I don't know if Roethlisberger has enough of a brain to have a concussion, but just my own 2 cents. So this is the one where a kid gets a concussion on the field, taken off the field, and he comes back to play before the concussion's totally healed. And it's actually the second impact, the second concussion that can be devastating. First described in '73. So again, you get your bell rung, as they say. Coach says, oh, you're fine, get back in there for next week's game. Kid still has a headache, still has visual problems, still can't sleep, still has clear concussion symptoms. Goes back and he gets his bell rung a second time. This can be devastating. Increased brain pressure, Second impact may be fairly mild. You don't need a bad concussion for the second impact to have this take place. The big one that occurred in Colorado was a kid named Jake Snakenberg, and he was a high school football player, and he went back to play before his first concussion was totally healed, had a second impact out in the field. There's been state law passed now that went into effect in January of last year, where by state law, if you have a concussion, you need a note from a physician before you can go back to play. One of the things we've worked on real hard in this valley is so-called impact testing. And this is the one that Kim Green's been real involved with. We have a whole youth sports initiative where every kid in the valley now gets impact testing. And this is the one where they get pre-participation testing and they get retested after the concussion. And you can't, but we've developed some guidelines, you can't go back to play until the impact testing is totally normalized. So the recommendation is the symptoms have to be gone and the impact testing has to be back to baseline before you can go back to play. We have to be strong advocates for the kid because, as you can imagine, the coach isn't always the best advocate. Coach wants to win. Trainer's working for the coach. Parents are convinced the kid's got to get a Division I scholarship to pay for school. So there's a lot, and the kid's like, yeah, I got to get back in there. So we've really tried to develop a situation where the kid has strong advocacy to make sure they're safe. Jake Snakenberg ain't going to college. He's dead as a result of this. So we've really worked hard with this impact testing in the valley. Now Eagle County Schools is behind it. Every kid, Ski Club Vail is behind it. Every kid now with Ski Club Vail gets impact testing before they start the season. If they have a ski-related head injury, they can't go back and run gates until this is normalized. So I don't know. Have you guys heard about this at all? Impact testing? Everybody familiar with it? Anybody have kids playing youth sports? No, not yet, huh? So again, down through the list, chest, abdomen injuries, usually male. You can whack your chest pretty hard in kids, but the ribs are so compliant, you don't fracture the ribs like you would with an adult, but you get internal organ injuries as a result of it. So if you have a contusion or chest injuries, you also have to be looking for internal organ injuries. You actually can get contusions of the heart or lung itself. Comissio cordis is sudden death on the slopes. It will respond to defibrillation, so it's helpful to know where the defibrillators are in the mountains. Kids generally don't get pelvic fractures. What's that?
Where the AEDs are on the mountain, like it's all pure ski patrol, or
I think the ski patrols carry them, don't they?
they don't carry them, but they have them
On top? On top of the mountain? Yeah. So obviously the big one we see in coming through the ERV or ortho injuries, you need to be very aware of the growth plate. Green stick fractures are common because the bones are so flexible. You can have multiple fractures. You can see quite a bit bleeding with fractures, particularly like a femur fracture, and there can be a lot of associated pain. So these kids are usually lined up down the ER. So in general, skier, think knee sprain, ACL or ligament disruption of the snowboarder, think rib fracture of the left hand, and think of that border belly injury as well. So this just gives you an idea here. This is the so-called growth plate at the distal end of the bone, the joints here. If you have any kind of fracture through the growth plate here, they're called Salter fractures. They need to be set very carefully to make sure that you get an optimal repair. So this just gives you a few ideas of some of the stuff you can see coming through. And this is a very good example of a green stick fracture. Again, because the kid's bones are so compliant and flexible, they'll go, and then they'll fracture like a green stick would rather than a really nasty compound fracture that we might see in adults. So here we go, helmets. This is what we want. Kids with a good fitting helmet on. And these are just, there is a whole evolving research on ski helmets that's out there. The Consumer Protection Council, nearly 20,000 skiing-related head injuries annually. The vast majority of the fatalities that occur other than the avalanche deaths are from traumatic brain injuries or head injuries. Majority of fatalities were not wearing a helmet. 44% of head injuries could be prevented with a helmet. 50% could be prevented or reduced in severity with a helmet. This data, I think, is a little dated. 2008 from the Northeast, only a third of kids had helmets on. In Austria, nearly 80% of kids had helmets on right before they passed their legislation. I think, anecdotally, this is much better. I mean, it's easily half or better when you go out there. In fact, now, Vail Associates, this is the third year now that they've required all staff to wear a helmet. If you're a skiing staff member with Vail Associates, you have to have a helmet. That raised a big hoo-ha. And if you're taking a lesson and you're a kid or teen, you got to have a helmet. So you're not required or mandated to have a helmet to ski, but you can take a lesson, and you can't work for Vail Associates unless you're willing to put a helmet on. Risk for head injury was higher in snowboarders with helmet use. Again, this is the terrain park factor. If you look at that tragedy last winter, the woman who was the pro snowboarder, you guys remember her name? Sarah Burke. Hit her spinal cord, right? Wasn't it a spinal cord tear? And then eventually passed away. So I just think that the nature of what kids are doing in the terrain park such that they're beating themselves up pretty good. This is the key article in the literature which showed definitively that you reduced your risk for head or brain injury by 60% wearing a ski helmet. So if you look in bike helmets, when they finally had good research to show that bike helmets worked, they were able to take that research, advocate for the intervention, and many counties and states actually go for legislative change based on the research. So this is a very key study that was done in JAMA that actually showed that the intervention worked. There's been quite a bit of controversy before then. The ski industry had actually hired a couple of PhD level researchers who were kind of hell-bent to show that not only did ski helmets not work, but they might have a deleterious effect. And so this article was very helpful to show, no, they do work, the intervention does work. And so this is a key step in advocacy, is being able to have good research to show it works. Failure to use a helmet increases TBI, brain. Helmets do not increase neck injuries, so that's good. That was been good to show. There's no difference in serious injuries between helmeted and non-helmeted group, and it does not increase cervical spine injuries. For males under 35, helmeted skiers take more risks than non-helmeted skiers. Occasional helmet users are the ones who have the highest risk for injury. And serious head injury in kids, half are intracranial bleeds, quarter with skull fractures. Skiers again tend to have collisions. Boarders tend to hit something from a fall or jump. Increased risk in terrain park versus ski runs. Terrain park injuries we talked about. Rate of skiing and boarding injuries among kids and teens is actually increasing. And I think some of this might be actually the terrain park effect. As more and more kids board and more kids are in terrain park, I think we might see an actually increase in head injuries related to that. Traumatic brain injury, trauma education has been shown to be successful to convince non-helmeted wearers to wear them. And then finally, fashion, comfort, and media coverage all can be helpful to advocate for helmet use. The Natasha story. Some good research now show there's no decrease in reaction time to peripheral stimuli with the helmet on, and no decrease in hearing key events from a safety standpoint. My view is unless you got Led Zeppelin really cranked up, then you might really have a problem. But kids wear helmets more than adults. How often you been in a lift line? I always get a kick out of this. You know, family of 4, 2 kids have their helmets on, right, and the parents don't. I'm like, what's up with that? They need you, income, right? And so it's really important when you advocate for helmet use to have the whole family use them. I do worry a little bit. You know, helmet rental has become very common on the mountain. The only problem with that is you have no history of the helmet. A ski helmet is supposed to be like a bike helmet. You know, when a bike helmet, if you take a bad hit, it's done. You're supposed to throw it out. Ski helmet's the same thing. If you've taken a bad hit to the ski helmet, you're supposed to trash it because the styrofoam has suffered all those microfractures that it's protected your brain from having. So the problem with the rental programs, you don't know anything about the history of the helmet. Still, I think probably better than nothing, for sure. But if you do buy a helmet, like I worry a little bit like the used helmet sales, you can see, you know, with the ski, a variety of the ski sales that come up, you can buy a used helmet, but you don't really know the history of the helmet. Still far better than no helmet. California state law, we talked about, all kids under 18 have to have a helmet to get on the slopes. And again, it's a one intervention or one impact intervention like a bike helmet. So this is what we want, kids with their helmets on. The one other word out there about ski injuries, don't forget about abuse and neglect, even though they're largely a wealthy population. If you see unexplained bruising, burns that don't make sense, inappropriate sexual acting out, excessive fear, anything unusual, wealthy kids can get abused too, even on a ski hill or on a vacation. So always keep child abuse, neglect, sexual abuse somewhere out there when you're seeing kids to keep that in your differential. So assessment, we can go through this fairly quickly. You guys, you know, do this all the time. ABCD, respiratory assessment, child's appearance. This is a particularly onerous one. This is called anisocoria. If you have essentially a blown pupil. So if you see a kid on the side of the hill who's had a head injury, even if they're fairly alert, but they've blown a pupil, one pupil is significantly larger than another. This is a very good marker for increased intracranial pressure, and that's a huge worrisome sign. That's a kid that needs to be evaluated very quickly, may have an evolving bleed that needs to be drained, or severe cerebral edema from a bad concussion. That's a very bad physical finding to notice. So again, ABCD, CPR, hypothermia, O2 as needed, watch for shock, small blood volume, easily dehydrated. And I'm just going to leaf through these because these are a little more for the ski patrol guys. Talk more about some ski management stuff. So there's the scene. Everybody's happy but the person in the sled going down the mountain. Look at her. She looks like, you know, maybe. Maybe. So tell them what you told them. Key take-home messages. Kids are not small adults. Growth and developmental behavioral issues you have to take into account. Faster metabolism, large surface area, thinner skin, risk for dehydration, smaller blood volume. Healthy hearts, they're not having heart attacks, but they have a lot of issues that make them at risk for respiratory problems. Bones, joints, and ligaments are more flexible. They have a problem. Always look for growth plate injuries. Head large for body size, so they're more at risk for neck injuries. Poor ability to regulate temperature. Management issues in the field. And ski helmets. So with that, this is 3 of my 5 kids. And Andy, before I say anything, I want you to know this beer here, it belongs to some derelict sitting here. It wasn't us, man. It wasn't us. That's not our beer. Because I know that was you were going to make that assumption. Andy, take great care of my wife. She had a total knee replacement a year ago here. And she's ready to get back skiing this year. So.
Looks like that guy with the bandana's been listening to some Zeppelin.
Yeah, or might have dipped into a few of those beers. So thank you to you guys. I think we do a great job here. If you see kids in the ER and we can help, call us. We're around. Hydration, pain. We're all have sedation privileges if we can help with that. And that's pretty much what I had today.